To Fly Live.
My dad used to tell me that you should only brush the teeth that you want to keep. If you've ever had a problem with something as benign as a cavity or something far more serious and painful, you know how you do not want to ever take your dental care for granted. So we are so happy this morning to have on the show Dr. Michael Hernandez, who is with Chattanooga Dental Care on Shallowford Road. Great to see you.
Hi, great to see you too.
And you know what? Dental care has come a long way. I was never a doctor-phobic child, but I used to be so afraid to go to the dentist that I would lock myself in the car. Little did I realize that my mom had the key and I was going to have to go anyway. But a lot of people, Dr. Hernandez, are afraid of going to the dentist, but you've gotten to a point where you can make it such a more pleasant experience for people.
Yes, here at Chattanooga Dental Care, we provide sedation dentistry for our patients. Something like 30 to 50% of people, it's estimated, have a fear of going to the dentist that keeps them from going. So it's a service that we provide that is helpful for a lot of people.
So does that mean that you can use the sedation dentistry even for something as routine as a teeth cleaning?
Yes, some patients require it even for a teeth cleaning. If they feel comfortable enough after seeing us for a few times, sometimes they can stop being sedated for the cleanings, but those people will still typically want to be sedated for any treatment that they might need to have. But it's just on a case-by-case basis. We see how comfortable you are. And we have different levels of sedation we can provide as well.
So when people come into your practice as a new patient, kind of walk us through the steps. So you first consult with them and find out about their dental history, and maybe in that conversation, the fear factor comes up?
Yes. For a new patient appointment, as for all of our appointments now, first we start with a questionnaire as far as COVID-19 symptoms. We take your temperature. You'll come into the office, and we have a special mouth rinse that we're using for patients now and having patients wash their hands. And all of the providers and patients are wearing masks until it's time to take a look at your teeth. We can't look at your teeth through a mask. But then we do take a dental history, and we question patients about how comfortable they are with receiving dental treatment, and whether or not that they would like to be sedated. Most people can be sedated. There are a few people who have medical conditions that would require us to not be able to do their sedation here, but that's not typical.
Well, I know one thing that you do in the office, and we'll touch back on some basic preventive measures too, but you do a lot of dental implants. What does that look like exactly, and who is a typical candidate for that?
Yes, a dental implant is a small titanium post that goes into the jawbone of a patient who has lost a tooth or who has lost several teeth. Most people are good candidates for that. There again, we would go over your medical history, and there are a couple of reasons why someone may not be able to receive an implant, but the majority of patients can receive an implant, and we also base that on their clinical exam. We have to make sure that there's enough bone to place an implant into, but that's all something that we talk about during our appointment.
Is the strength of your teeth and the health of your teeth to some degree genetic? Do some people just have teeth issues that run in their families and other people don't?
There are some genetic components to oral health. The biggest factor is how we take care of our teeth and our diets. Coming to the dentist every 6 months. There are some people who kind of start out a little bit behind others due to their genetics, but most people, if they're coming to the dentist on a regular basis and taking care of their teeth, can expect to maintain their teeth into old age.
So talk about that maintenance. I'm sure that we get a pretty failing grade as a country when it comes to flossing. Is that true?
I hear a lot of people don't floss. I don't know what that's about, but we do recommend flossing every night. You only need to floss once a day minimum. You can floss more than that if you'd like, but come to the dentist on a regular basis, and we'll talk about what your habits are, and we'll make recommendations for you. But we always recommend flossing once a day and brushing your teeth every morning and every night. And you can add an extra one in there if you'd like, but the minimum should be twice a day for brushing.
Is there a concern with the teeth whitening over-the-counter things that you can buy, do they end up damaging the enamel on your teeth?
No, the whitening products that are sold specifically as whitening strips, they won't damage your enamel. However, home remedy whitening options that include abrasive products, baking soda, things like that, that can damage the enamel of your teeth. So if you wanted to whiten your teeth, you could consult with your dentist, or the whitening strips that are sold over the counter. Whitening toothpaste also has an effect, even though it's a lesser effect and it takes a little more time. But I would stick with the products that are dentist approved.
And if you're buying a new toothbrush, I'm sure you give those out in the office too when your patients come for a visit. Do you like a soft or a medium bristle?
We recommend a soft bristle toothbrush. The manual toothbrushes are great. Now lots of people have a mechanical electric toothbrush that can have a little edge on the old style manual toothbrushes, but as long as you're brushing your teeth, you're doing a great job. The newer electric ones can help a little bit, and definitely a soft bristle toothbrush.
And then real quickly before I let you run see your patients for the day, you mentioned going every 6 months. It's not just from a vanity standpoint to keep those teeth pearly white, but your dental care, your dental health rather, can be an indicator of your other physical health, right?
Yes. Most people, we recommend coming every 6 months. There are a few people out there who need to come a little bit more frequently, but if you have gum disease, or also known as periodontal disease, it's a source of inflammation in your body, which studies have shown that can lead to detrimental health effects in other parts of your body. So coming to the dentist on a regular basis is definitely a good idea for not just your oral health, but your overall health.
And are you family dentistry? Can people of everybody in the family come to see you?
Yes, we see anybody from young children to patients that are advanced in age. But we offer sedation and we offer implants, but we also are family dentistry.
Well, we are so glad that you were able to share some time with us this morning, and thank you so much for your smile.
Well, thank you very much. It's been great to be on with you, and we would be happy to see any of your viewers here at the office, and they can contact us through our website, ChattanoogaDentalCare.com.
All right, and the phone number as well is 799-4008. They're near the post office there on Shallowford Road. Happy to see you when you can give them a call. We're back with more 3+U right after this. Thank you so much. Was that?
If you're even thinking about making a move this year, then you need to talk with me about my guaranteed offer. You see, with the